Hi, Mr. Smith. My name is Jeff. I'm going to be your nurse today. Before we get started, can I just check your ID band? So just give me a thumbs up or thumbs down if this information is correct or not, okay? So your name is John Smith, thumbs up, and your birthday was January 1st, 1950? Yes? Okay, thank you. So do you have any allergies, Mr. Smith? No? Not to chlorhexidine, alcohol, tape? No? Okay, very good. So I'm just going to sit you up to a 45-degree angle. So I'm going to be doing some trach care for you today. So have you had trach care done before? Yeah? Did you have any problems with it in the past? No? Okay. Are you in any pain right now? No? Good. So what I'm going to be doing is I'm going to see if we need to suction any secretions out of your lungs. I'm going to change your inner cannula. I'm going to clean the faceplate and around the trach. And I'm also going to change the neckties that tie it down. Okay, so do you have any questions for me before we get started? No? Okay, sounds good. So before we do start, I'm just going to double check all my emergency equipment is in place. So I have my ambu bag connected to 15 liters per minute of 100% oxygen. It's turned on. I have my suction catheter. It's set to continuous between 100 and 120. I have a oxygen mask in case we need to give you breath through your mouth instead of your trach. I also have two extra trachs, one the same size and one a size smaller. Okay, so to start, I'm just going to set up my workstation. So I'm going to do hand hygiene. I'm going to put on clean gloves. I'm just going to wipe it down, sanitize the surface. Okay, go around the edges as well. Okay, drop that in the trash. Take these off. And I'm going to let the surface of the table air dry for a whole 2 minutes. And while we're waiting for that to air dry, I'm just going to take a listen to your lung sounds. So when I say okay, just give me a deep breath, alright? Okay. 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 Alright, so I do hear secretions in there, so I am going to suction those out. And I'll put this towel over you so we don't get any secretions coming flying out and landing on your gown. Okay, so we'll say it's been 2 minutes and the table is dry now. So now I can put all my equipment up on the table. So I have my 2 trach kits. I've got an inner cannula, clean gloves, an extra set of sterile gloves, normal saline, and my suction catheter. Alright, so first I'm going to change the suction catheter out because I don't know if that one there when I walked in is dirty or not. So I want to make sure we have a clean one to use. Alright, so I'll take this one off, throw it in the trash, take my new one, attach it, and make sure it's set to continuous between 100 and 120, which it is. Alright, so I'll take these gloves off, do hand hygiene. I'm going to put another pair of gloves on. I'm going to take the little box from my suction catheter, the little container. I'm going to pour some normal saline into it. Okay. And before I suction, I'm just going to close the curtains to give us some privacy. And I'm going to give you a few breaths through your trach to get your O2 sat up. When I checked your lung sounds, it's at 94%. So we want to get that up a little bit before we suction, okay? Alright, so I'm going to take the oxygen off. Get the ambu bag. I'm going to give you 3 breaths, which are 6 to 8 seconds apart each. I'm going to hold the faceplate down, attach the ambu bag. 1, 2, 3. Okay, and it looks like your oxygen saturation is up to 100%, so that's awesome. Alright, so we're ready to suction now. So I'm going to take my my suction catheter. I'm going to extend the tip out 3 to 4 inches. And I'm going to dip it in my normal saline to test the suction. I see it go up the tubing, so I know it's working. And I moisten the tip with the normal saline so it goes into the trach easier. Okay, are you ready, Mr. Smith? So I'm going to insert the suction catheter until I feel resistance or he starts coughing. Alright, so ready? 1, 2, 3. Alright, so I feel some resistance, so I'm going to stop pushing it in. And now I'm going to start taking it out, twisting it back and forth as I do. And the catheter goes back into the outer wrapping. So how's that, Mr. Smith? Doing okay? Does it feel like I need to make another pass? No, it feels good? Okay, very good. So if you did want me to make another pass, I would just have to wait at least 30 seconds in between passes. Alright. Okay, so I'll put your oxygen mask back on for a second. Let that O2 come back up. So I can take these off. So that's the suctioning done. I'm going to get ready to do some trach care. Alright. Oh, first I'll move this normal saline box back. I'll do hand hygiene. Okay, so I can open up my trach kit. I'm going to take the drape out. Don't need that. And take my sterile gloves out. Alright, so now I'm going to just pour some normal saline into my trach kit. Alright, and I'm going to do hand hygiene. And I'm going to put my inner cannula, my new one, into my trach kit as well. Drop it in, throw away the wrapper, do hand hygiene. Now I can put my sterile gloves on. Alright. Okay, so I'll keep these above my waist, nice and tight to my body. Throw away the trash. Alright, so I'm going to be doing some cleaning now on your trach. So I'm going to first change the inner cannula. So I'm going to take the oxygen off with my left hand. And then with my right hand, I'm going to take out the inner cannula and hold the faceplate down with my left hand. Okay, take it out, throw it in the trash, take my new inner cannula, my right hand, hold the faceplate down, insert the new one. Okay? And so now the inner cannula is off, so I'm just going to put the O2 back on for a few seconds. Let your oxygen saturation come back up again before I do some cleaning. Okay, doing all right, Mr. Smith? Good. All right, so I'll take this off again. And now I'm going to change out the split gauze dressing underneath the faceplate. Okay, so I'll take that out, throw it in the trash. Now that that's off, I can do a site assessment of the skin around the tracheostomy. So I'm looking for any signs of skin breakdown, infection. I don't see any redness, swelling, or bleeding. So the site looks good. Okay, so now I'm going to clean around the site. So I'm going to take my Q-tip, dip it in my normal saline, and I'm going to clean underneath the faceplate with this one. Alright, good. Take my other Q-tip, dip it in the normal saline. I'm going to clean the outside on this one, getting off these dried secretions. Take a gauze, dip it in the normal saline, get off these big chunks of dried on secretions. Alright, looks nice and clean now. Then I'll take my dry gauze, just pat down the outside, make sure it's not wet anymore. Okay, and I'm just going to put the new split gauze dressing on underneath the faceplate. Alrighty. Alright, that's good. Okay, so the dressing is done, so I'll just put the O2 sat back on. Let you get your O2 sat up again. So next thing I'm going to do is change the neckties, and for that process I need my second nurse. So I have Melissa here, she's going to help me out. So I'm just going to take these sterile gloves off, do hand hygiene. I'm going to put clean gloves on. So while I'm untying my side, Melissa's going to be holding down the faceplate to make sure it doesn't come dislodged or loose or anything like that. Alright, so I'm going to take your oxygen off, and I'm going to untie this side, my side. So Melissa's holding down the faceplate, and tie my side and thread it through to her side. And now that I've taken the necktie off, I can do a site assessment of the skin where the tie was over. So I don't see any signs of skin breakdown. Again, no redness, swelling, signs of infection. So it all looks good. So I'm going to take my new trach tie, necktie, tie this onto my side. Okay, and then thread it through to Melissa's side. And now we're going to switch roles. So now while she's untying her side, I'm going to be holding down the faceplate. Alright, so she's untying her side now. So we can throw this old one away. And now Melissa is going to do a site assessment on her side of the neck. So it doesn't look like there's any signs of skin breakdown, redness, swelling, no bleeding. So again, it looks good. Alright, so I'm still holding the faceplate down, and Melissa's going to tie her side with the new trach tie. Alright, so the new trach tie is on. And we're just going to make sure we can fit 2 fingers beneath the trach ties and between the neck to make sure it's not too tight and to make sure it's not going to get too loose or dislodge. So 2 fingers fit, so it looks good. Alright, so how are you doing, Mr. Smith? Everything going okay still? Let me put your oxygen back on. Get your O2 sat up. Doing okay? No pain? Okay, good. So do you have any questions for me? No? Alright, so I'm going to put you down in the lowest bed position. I'm going to get your call bell and put it right here next to you. So just press that if you need anything. And myself or another nurse will come and assist you. So any questions? No? Okay. Thank you very much for your cooperation, Mr. Smith. I'll be back to check on you again pretty soon, okay? Alright, so before I leave the room, I'm just going to change the suction catheter that I use because it's dirty now. So I take off the old one, throw it in the trash, take a new one, attach it, and I'm going to check all my emergency equipment again before I leave. So the suction catheter I just put on is set to continuous between 100 and 120. The ambu bag here is set to, it's connected to 15 liters per minute of 100% oxygen. It's turned on. I also have an oxygen mask for the ambu bag in case we need to give breath through the mouth instead of the tracheostomy. And I also have 2 extra trachs, one the same size and one a size smaller. Alright, so I'll throw away these gloves, do hand hygiene. Now I'm going to clean up my workstation. Okay, throw this in the trash. And now I'm just going to document. So I'm going to document the date, time, and my initials. Going to document the patient's tolerance of the procedure, the color, consistency, and amount of the sputum, the vital signs and the O2 sat, and my respiratory assessment.